Good afternoon, everyone. In fact, good evening within 2 minutes. Thank you, Dr. Rohit Shetty, sir, and Radhika, madam, and AIOS Microvision for this opportunity. So I'll speaking a little bit about the artificial intelligence, what's going on in the retina. I'm sure that the term you all know about the term artificial intelligence refers to a specific field of computer engineering that focuses more on creating systems capable of gathering data and making decisions or solving them easily. So some of them are already here. So what are they? I'm sure majority of us are using the Siri, the Alexa, the email spam filtering, social media, personalized ads, face recognitions, Google Photos, Facebook Photos, Instagram Photos, so on and so forth. So for the basic in touch about the artificial intelligence, it's divided into the machine learning, the deep learning, and the neural networking. So what does each of these does? I'll just go a little bit about it. So the machine learning usually provides the computer's capability to recognize and understand the patterns and improve its own algorithms within its time. Say for example, I'm sure that most of us listen to the Ghana or the Netflix or most of these apps, right? So whenever you go to that app and open those apps, they say these are the new recommended movies, and this is the percentage of matching that happens with the movies which you have already watched. So that's nothing but is more about the machine learning. That is, you make the machine learn about what are your preferences and what are your patterns. Then comes the deep learning. So what is deep learning? Deep learning is the algorithms where it has its own prediction. Whether it's accurate or not, it's again a secondary factor because it's going on into a lot of secondary work. So for example, switch on the light. When you give a command, it switches on the light, which is more of a machine learning. When it can take up the phrases, oh my God, it's so dark here, and then it switches on the light, it's what is more about the deep learning. So what's more about the neural networking? It's a system of hardware and software where patterned after the operation of the neurons. For example, check processing, speech to text, facial recognition, handwriting recognition. So it's a little bit more complex scenario is what works on the neural network. So if you try to compare between the deep learning and the machine learning, the deep learning requires a lot of data, but machine learning can train on a lesser data. The accuracy is very high accurate, but whereas machine learning is slightly less accurate. So what's the difference? How does it recognize the retinal patterns, the retinal anatomical patterns and everything? You just give an input that here is a hard exudate, here is a soft exudate, here are the hemorrhages. So it goes into the feature extraction. It makes a different classification as which is mild NPDR, moderate NPDR, severe NPDR. Then it gives you whether it is referable or non-referable. That's the output given by the classic machine learning. But what happens in case of deep learning? You just try to identify these pictures and give the machine that, okay, these are the hard exudates here, these are the hemorrhage, these are the soft exudate, these are the drusen. Then it calculates itself. The self-classification itself, where it gives you whether it's referable or non-referable, is what is more about the deep learning. So in machine learning, we have two, that is the supervised machine learning and unsupervised machine learning. In supervised, it can learn the pathological features of a disease from training sets, whereas even an extrapolation from the patterns recognized independently is unsupervised machine learning. So what are the scope of this? It helps in the screening, the diagnostic grading, the guiding for the therapy, automatic identification of recurrence, quantifying the therapeutic response, and also the prediction and the prognostic conclusions. So this is the hype of the AI curve. I'll not go into the details of it. I think the previous speakers might have already covered about this. So artificial intelligence, this is a small example I'm showing is about the fluid intelligence, right? So what it does, it's the retinal AI intelligence where you can choose the retinal map. Say for example, you take the retinal fundus photograph, either you take it from the photo library or you capture it with a slit lamp and then ask it to compute. AI is computing the diagnosis and this gives you, oh, this is the wet AMD. It also gives how much is the specificity and the sensitivity of it. Not just that, it also gives you a differential diagnosis, whether it's a diabetic macular edema, whether it's a vein occlusion, wet AMD, and what are the differential diagnoses compared for this. So the Google AI, it actually uses the retinal scans to even estimate the heart disease risk I think most of us have already listened to Sundar Pichai's lecture on the Google, and we are proud that Shankar Netralaya and Arvind are working more hard with the Google to work more on these machine learning. So a little bit of the success stories, the DR screening using 3 different commercial available software package, a convoluted networking applied to the OCT was able to successfully differentiate cases with advanced AMD or diabetic macular edema which require timely treatment from less severe cases. So there is also a role of artificial intelligence not only in OCT but also in OCT angiography as well, because the deep learning was able to infer the flow from the single structure OCT image, which was fidelity to the OCTA and significantly better than even the expert clinician. So if the artificial intelligence in fact comes into a OCTA, it makes it's a lot of difficulty now to make the manual segmentation. But if it comes in, if it makes the manual segmentation, the automatic segmentation, then it's just a few of the seconds we'll get to know that whether the patient has a neovascular AMD, whether he has a networking pattern. Then probably we do not, the angiography, the fluorescein angiography will walk away very soon. Now coming to IART AI, that's the diabetic retinopathy screening system, which has been approved by European Union as well as Health Canada. Here, step 1 is again taking the retinal fundus images, then submit the image for the cloud for the analysis, and step 3 is download and give an export of the PDF report. But the more US FDA is now IDXDR, that's the AI diagnostic system that detects the signs of the diabetic retinopathy in retinal images, which is proven to be effective in real world clinical workflows, result less than a minute, absolutely no human grader, and clinically validated with high sensitivity and specificity. And we are proud that our own Indian, of course he's an American, Dr. Vas Sada is working more on IDXDR. So how it works, using a fundus camera, the trained operator captures 2 colors of 45 degrees field of view, and then it is transferred from the camera to the IDXDR client on the computer. The third one is the images are submitted from the analysis system, and then within 1 minute the IDXDR gives an image quality. Whether it is negative for diabetic retinopathy, the patient can be rescreened later. If it is positive, then it tells you that better go and meet a physician. So this is how the report has been given, gives about the IDXDR is exam quality, was it sufficient or insufficient. If insufficient, then it tries to take on its own. If the patient is negative for referable DR, then it can be asked you to come at a normal interval. If the patient is having any signs of referable DR, then it asks you to go and meet a physician or have a teleconsultation. The automatic Drusen quantification and risk assessment of age-related macular degeneration on color fundus photograph is also being done by the AI. The machine learning used to identify and even quantify the Drusen. In fact, if we went into the Vasada's literature, he almost like he has gone inside the Drusen and tried to explore more about the Drusen, and that's what is going more into the artificial intelligence. The another one is the Notal Vision's home-based OCT. It takes around 10 OCTs per day. The OCTs are uploaded to the cloud, and sitting at the home, the doctor can tell you whether you want to come to the clinic or stay at home, and you can have a visit later. So there's the expert diagnosis of plus disease in retinopathy of prematurity from computer-based image analysis, and also the automated diagnosis of plus disease. It's so easy, there's no questions on how to grade the plus disease, how not to grade the plus disease for the fellows and the residents, because the artificial intelligence does its work. And how do you identify the plus disease? Then the answer is the AI recognizes it, not me. So that might be the future. So there is also a project ALZI, that is University College of London plus Moorfield Eye Institute and Google DeepMind AI system. In collaboration, they are trying to screen algorithm for Alzheimer's through the analysis of the fundus images. So there are also, they are looking into the biomarkers for artificial intelligence. I'll not go into the detail of it, but one thing I would definitely like to tell about is the black box phenomenon. The researcher actually do not know how the machine calculates it. Of course, when I told you about the machine learning, where the lesion, it is based on disease detection, quality assessment, see here are the hemorrhages, this is the subretinal hemorrhage, this is the pre-retinal hemorrhage, lesion detection happen, anatomical localization, whether it's at the pre-retinal level, or it's at the inner retina, or it's the subretinal layer, then the assessment, then whether he's having an age-related macular degeneration or diabetic retinopathy, it gives us. But here, in the black box detection, disease detection, it takes up, and still the researchers are not being able to find out how it actually does the calculation. But it is giving a 95% specificity and sensitivity. Now you can argue, what about those 5? The papers have suggested that probably that 5, the researchers might have an intra-observer variability. So it's trying to say that there is a 5% error of the humans and not the computers. So we still do not know. So that's more about the black box phenomenon. And where all AI is used: screening of the patients, booking profile in the clinic, reading images to support the retina specialist, diagnosis, prognosis, personalized medicine to optimize treatment, novel treatment. I think many of speakers have already spoken about it. Monitoring of the treatment, identifying features on images we cannot perceive. And the last one is, it asks us to go home from your own hospital and do not come back again. So there are various studies which have already been done. I think I took it from one of my friend, Dr. Srikanth, who is in Bangalore. They are doing a Medios AI on Remedio. So they are trying to find out a new algorithm for assessment of diabetic retinopathy, and they have been quite successful. So the new grading is the mild, moderate, severe NPDR and PDR. They are doing at rural areas, and using the AI from the Medios technology, Singapore. They are trying to develop it using the mobile phones. So, not going to the details, I would like to acknowledge my fellow Dr. Giriraj for helping me in this presentation, and time is up. Thank you very much for the patient listening.